Hello everyone, I want to introduce myself. My name is Priour. I'm studying in Farmasi Politeknik Katolik Mangunwijaya, Semarang. Okay, we are back to my new YouTube channel, which is Case Study 20. And I will present the Conversation 20 case. With the title in this case, it's discuss acting without prior consent due to an unforeseen medical problem. But before I give an opinion, I will read the material. Case Study 20. Acting without prior consent due to an unforeseen medical problem. When Mr. M, a 52 years old male, was referred to Dr. C, he was in a very serious state. His symptoms include fever, headache, dry tongue, sinus infection, and general septic poisoning. Urinalysis indicate his urine was badly infected. He had stones in his bladder and a large stone in his kidney. Dr. C operated on Mr. M in May, draining his bladder and removing the bladder stones. The patient was subsequently treated with injection and his bladder condition improved. He continued to experience severe pain on his left side and had also developed a hernia. A second operation was performed to alleviate the patient's overall physical condition. Several months after the second operation, Mr. M gave his consent to have surgery to repair his hernia. A day or two after the operation, Mr. M was informed by Dr. C that his testicle had also been removed during the surgery due to potential problems it might have caused. In response, Mr. M said he had not given his consent to the removal of his testicle and had never been informed that it might be necessary. Their eminent surgeons supported the concerns of Dr. C procedure. They said that no surgeon could have anticipated the condition and that further surgery had been necessary. Okay, and then I want to answer a question from Mr. Gregorius Daru. The question is, should Dr. C delay to operation until Mr. M can give his consent for the operation? Informed consent is the process of delivering information between the medical team and the patient before giving a decision. One example of medical treatment that requires informed consent is surgery, blood transfusion, or other things. Information in informed consent must also be related to several things, among other diagnosis of the patient condition, name and purpose of medical treatment, benefits, risk of the procedure, and alternative medical procedure that will be passed later. And my opinion is a yes, because if a doctor performs surgery without the permission or consent of a patient, the side is that the doctor violates a patient's rights to argue or violate the human right and professional ethics of a doctor, because or action put in hospital or other place must have the consent of the patient or family involved. That a patient has rights and obligations including right 1. Obtain human fair and honest service. 2. Obtain health service. 3. Get the privacy and confidentiality of the illness. 4. Give approval of rejection of action to be taken next. Obligation 1. Provide honest info. 2. Obey to the recommended therapeutic plan. In this case, the patient has not agreed to operate on his testes because Mr. M has a hernia. Hernia is a disease caused by the decline of the testes as the muscular lining of the abdominal wall weakens, so Mr. M feels pain in the left side of the stomach. In this case, the testes can be removed only by surgery. If the procedure is considered an emergency or save the life of a person with the agreement. If it's not an emergency, then a doctor C must postpone the procedure so that a patient or family can give his consent, because it is the right of the patient. Every medical treatment requires the approval of a patent informant. The important meaning of this agreement is that a person agrees, treats at the invocation of this body, understands the importance of this medical condition and the meaning of the treatment, the dangers and benefits that exist in a treatment to be faced. Thank you everyone for your watching my opinion case study 20, acting without prior consent due to an unforeseen medical problem. Stay healthy.